Good morning. Today we are joined by Sheila Mihalick. Sheila is the program director for the St. Louis Empowerment Center's Recovery Community Center. She earned Missouri's Certified Peer Specialist credential in 2017 and has been a CPS trainer since 2019. She is also a hub team member for the University of Missouri Telehealth Network, Show Me Echo for Certified Peer Specialists, and sits on the Advisory Council for the Mo Hope Project. Sheila received her PhD in experimental psychology in 1997 and serves as an adjunct professor for Webster University. Please join me in welcoming Sheila.
Good morning, everyone. It's great to be here. Bright and early, first session of the day. I hope that everyone is going to have a great day today. All right, so yes, this is the Opioid Overdose Education and Narcan Training session. Welcome, everyone, and good morning. So to begin, I would like to point out that dead people never find recovery from opioid use disorder. So we need to learn better how to educate and equip peers who may still actively use or have a recurrence of use after periods of recovery. This session provides an introduction to opioids, how they work, how to educate our peers on being safe if they continue to use or have a recurrence of use, and how to reverse an opioid overdose if it occurs by using rescue breathing and Narcan. The objectives for this presentation are to provide information on opioids and opioid overdose, some background, provide a brief snapshot of the landscape of the problem here in Missouri, provide a few harm reduction tips, and finally, education, overdose education, and then I'll hop off the presentation PowerPoint and show you the elements of what's required to reverse an overdose with Narcan. So what are opioids? We actually have kind of two classes. Opiates, over here, they're drugs that come from the opium poppy. They come from a plant. Examples include, but aren't limited to, codeine, morphine, and heroin. Opioids include all the opiates and any other substance, natural or synthetic, that bind to the brain's opioid receptors. Examples include, but aren't limited to, methadone, fentanyl, heroin. A good way to remember the difference is to note that while all opiates are opioids, not all opioids are opiates. It's also important to remember that just because opiates are natural from a plant does not make them less harmful. Most opioids happen to be legal, prescription only. Commonly used opioids include, but aren't limited to, here we have the generics on the left and brand names on the right. Again, this is not an all-inclusive list, but codeine is also known as Tylenol 3. Oxycodone is found in OxyContin, Percodan, Percocet. Hydrocodone can be found in Vicodin, Lorcet, Lortab. Hydromorphone can be found in Dilaudid. Fentanyl comes in brand name form Duragesic, Subsys. Morphine, there are various brand names. One of them is Morphabond. Meperidine, also known as Demerol. And methadone, also known as methadose in some cases. So how do opioids work? Opioids attach themselves or bind to natural opiate receptors on neurons in the brain and call those neurons nerve cells. I like to think of the receptor as a key. And then I will repeat what are opioids, in that opiates are drugs derived from the opium poppy. Examples include, but are not limited to, codeine, morphine, heroin. Opioids include all the opiates and any other substance that bind to the brain's opioid receptors. Examples include methadone, fentanyl, and heroin. While all opiates are opioids, not all opioids are opiates. It is also important to remember that just because opiates are natural from the plant does not mean that they are less harmful. Most opioids are legal prescription-only medications. Commonly used opioids include the ones on this list. This includes, but is not limited to, the generic codeine, which we might know as Tylenol 3. Oxycodone is in OxyContin, Percodan, Percocet. Hydrocodone is found in Vicodin, Lorcet, Lortab. Hydromorphone is known by the brand name Dilaudid. Fentanyl can be known as Duragesic or Subsys. Morphine has a brand name, at least one brand name, Morphabond. Meperidine is known as Demerol, and methadone brand name would be Methadose. So how do opioids work? Opioids attach themselves or bind to natural opiate receptors on neurons or nerve cells in the brain. I like to think of this as a lock and key system. The lock are the receptors sitting on the neurons, and the key is the opioid molecule that attaches to it. Once the opioids bind to these receptors, those neurons send signals to the brain which cause what we call the opioid effect. The opioid effect causes, among other things, analgesia, blocks pain, euphoria. It floods the brain's reward system, and boy, did we feel good. And the opioid effect also causes respiratory depression. It slows your breathing down and continues to slow your breathing down depending on quantity and dosages. And without intervention, breathing will stop. This is how people die from an opioid overdose. They stop breathing. So in Missouri, we know treatment admissions have been on the rise, and they continue to rise even more steeply today. Same for hospital visits, especially visits to the emergency room. Unfortunately, overdose deaths among certain demographic populations in the state are steadily increasing as well. And what's driving these overdose rates, heroin and fentanyl, lately fentanyl has become the primary driver of overdose death rates. And as a result, what we see is not just an increase in overdose deaths, but one that basically doubles every time. So that's an exponential increase. What is naloxone? Naloxone, also known as Narcan, naloxone is the generic name of the opioid overdose rescue drug, Narcan. Naloxone works by replacing opioids on the receptors in our brain. The natural opiate receptors that lock the opioids we might take to manage our pain, or if we're having substance use, opioid use disorder, the opioids fit into the lock kind of loosely. Naloxone fits the lock much, much better. And so when naloxone is introduced to the body, it pops the opioids off those receptors because the receptor, that lock, really wants to have a stronger key inside of it. And so naloxone popping those opioids off of the receptors means that the opioid effect stops and breathing can be restored. Naloxone can reverse an overdose in about 2 to 5 minutes, give or take. Please note, and this is very important, times will vary based on body size, amount and type of opioids used, a person's tolerance. There are many factors to consider, but approximately 5 minutes, we might see a reverse of an opioid overdose. Types or brand names of naloxone include the injectable kind. This is an intramuscular, so that either goes into the back side or the thigh. Those would be intramuscular locations to inject naloxone. You can get it in a prepackaged nasal spray or Narcan, which is what we'll be seeing here shortly. It also comes as an auto-injectable, brand name Vizio. The auto-injectable is a little bit on the pricey side. However, what is great about the auto-injectable is that it actually provides out loud instructions on what you need to do in order to take care of an overdose. So it talks you through it. Yes. Very important. Naloxone cannot get you high. It can't get you high. Nothing will happen other than it will pop off any opioids on our opiate receptors, and it will remain on those receptors approximately an hour, maybe, give or take, again, depending on body size, etc. Know that when naloxone is on our brain receptors, those opioid molecules are still in our brain. And therefore, two things will happen. One, when a person is revived with naloxone and breathing has been restored, that person will be in immediate withdrawal. And they're going to want to go stop those bad physical feelings that accompany withdrawal. We want to try our best. Now, it's not up to you in terms of physically preventing people, but if you can inform people that if they go use right away, that the chances of their having another overdose will increase significantly. Just wanted to point those out. Those points out. So when we talk about engaging in treatment, something called the overdose treatment paradox. So when a person engages in treatment for opioid use disorder, the individuals will either reduce or completely eliminate their use of opioids, and that decreases their risk. However, when that happens, over time, the brain has built up a bunch of receptors to accommodate all of the opioids that are being consumed. But when an individual has reduced or eliminated their drug use, then their tolerance becomes lower. Their brain kind of trims back those receptors that are no longer being used. As a result, individuals who have been in treatment, when they come out of treatment, their tolerance is much lower than it was before they went into treatment. People tend to consume the same or similar quantities of substances that they did before treatment. And if that happens in an individual with lower tolerance, then it increases the risk that they might overdose. So how can we help an individual decrease their risk? These are harm reduction tips. This is not advocating that people support the use of opioids other than what a doctor may prescribe. But we do know that people are going to use them. And so just from a health perspective and a harm reduction perspective, it's important to never use alone. If you use alone, there is no opportunity for anybody to revive you or call EMS to revive you from an overdose. If the person is using with a partner, stagger your use, meaning one person goes first and the other person waits for a few minutes to see whether or not person number one might need to have an overdose reversed. So staggering your use is one way to reduce the risk. Never use behind a locked door. I know people would go into restrooms, public restrooms, private homes, and because they don't want people to see what they're doing, they'll lock the door. If you lock the door and you have an overdose event, nobody can get into where you are and treat you with naloxone. Also, start low, go slow, meaning if you're getting your substances from the streets and not from your doctor, or if you're misusing prescription opioids, start low, meaning start with the lowest possible dose that you can, and then take it very, very slowly to the level that you're accustomed to using, because we don't always know the potency of the substances you might get on the street. Some might be much, much, much more deadly than others. And so a harm reduction tip would then be to just make sure you don't start off with a big dose. You don't know what the content is. It's typically fentanyl. We've got carfentanil and other fentanyls that multiply the danger. So start low, go slow. And always have naloxone and make sure everyone knows how to use it. So we're here to learn how to use it. So you are already engaging in some harm reduction right now. How can you tell if someone's overdosing? You might hear some gurgling or a deep snoring sound that comes from deep inside. This is something that's known as the death rattle. If you hear it, I hope you don't ever hear it, but if you hear it, you'll know it when you hear it. The skin will become blue or grayish. Usually your fingertips and lips begin to lose the oxygen, which causes that blue or grayish skin. In Caucasians, blue or grayish lips is one way to tell. And some African Americans, their lips may turn a whitish or a yellowish color. depending. So if you see any of those signs, I would look at the lips and the fingertips. If they are not getting oxygen, they'll turn those bluish or whitish colors, and that tells you that they're probably in an overdose situation. The skin gets cold and clammy, might be sweaty, person might be sweaty. They'll definitely be on what we call a heavy nod, so they will be very out of it. And if they're overdosing, in fact, they won't respond to any stimulation. Even a painful stimulation, meaning if you took your middle knuckle and rubbed it on a person's breastbone or into into the side of the arm firmly, that's a little bit of a painful stimulus. And if the individual is not responding and also has these other signs of an overdose, you'll notice that their breathing is either going to be very slow, will be very irregular, or has stopped altogether. And finally, you can look at the person's pupils. Pinpoint pupils is pretty literally what happens when someone is using opioids. The pupils do not dilate and get bigger. They contract to the size of a pinhead. All of these are signs that someone is in an opioid overdose. So what do you do? Someone overdoses. First, check to see if the airway is obstructed, because you've just come upon this individual. And what's most important, because breathing has stopped, that we give the individual 2 rescue breaths. In the age of COVID, that might sound a little scary. However, we do have, believe it or not, we do have protective equipment that can help you give those rescue breaths. I will show this to you at the end of the PowerPoint when I demonstrate the Narcan. So see if the airway is obstructed, give 2 rescue breaths. We don't know how long the individual has been without oxygen. Then, if you have a Narcan package, you have 2 units. So after you've given those 2 rescue breaths, you'll take one of the units of naloxone in the Narcan and you will administer it. With Narcan, it's a nasal spray. It goes right up the nose and you plunge the plunger, and the naloxone gets to where it needs to go. Give one more rescue breath before turning the person into the recovery position on their side with one arm reaching over to touch the floor so that's in the recovery position in case there is vomiting that occurs during revival while you're calling 911. We want to make sure that they don't aspirate or breathe in that potential vomiting. So then you call 911 and then immediately return to the individual and continue rescue breathing for about 2 minutes or so. And if they have not been revived after about 2 minutes, give the second dose of naloxone. Then just continue breathing for the individual until emergency services arrives. It's important for us, for all of us in Missouri, to know how well Narcan is saving people's lives so that they are able to find recovery. And so we ask that if you do reverse a opioid overdose with Narcan or naloxone of any kind, please report that there is a form that you can fill out at the Mohope Project page. And the link is here, mohopeproject.org/OD report. Where can you get naloxone? In Missouri, there is something called a standing order that was written by a physician that essentially enables anybody to get naloxone without a prescription. Pharmacies will stock naloxone. There are going to be some pharmacies that don't believe in stocking naloxone or Narcan, and so I would call ahead first to make sure that they do stock naloxone. And then if they do, when you go to the pharmacy, ask to speak with a pharmacist specifically about naloxone. They will likely sell it to you. The cost may be around $100, $150. It's possible that the pharmacy might be able to bill your insurance for that cost. Even without a prescription, you can try. But you can get naloxone without a prescription from pharmacies across the state due to this standing order that serves as a blanket prescription. Limited supplies of free naloxone can be obtained from several places. NCADA, we have the information. You can call or email or request info@ncada-stl.org, or you can go to the web, mohopeproject.org/resources/get-naloxone. There are 4 recovery community centers currently in Missouri. There are 2 in St. Louis, there's 1 in Kansas City, and 1 in Springfield. So the Missouri Network for Opiate Reform and Recovery, also known as MONET, they can provide and do provide free naloxone, among other harm reduction activities. Healing House in Kansas City also has free Narcan. We at the St. Louis Empowerment Center absolutely have free Narcan available. And the Springfield Recovery Community Center, again, you can get free naloxone from any one of these community centers. I recognize that many people do not live in these metropolitan areas. So if you're unable to get naloxone locally, perhaps your pharmacist or the pharmacy has declined to stock the naloxone and you can't get it from your pharmacy, and you're unable to access it through your local public health department, you may be able to get it mailed by going to visit more sources, yes, no. So that's the URL in order to determine whether you can get naloxone mailed to you. And this is a slide of sources that I have used for this presentation. And now let me see if I can unshare my screen and get my face back into view so that I can go through how to, or what you're going to see with the Narcan and how to use it. So give me just a minute. And hopefully you can see my face now. Can anybody not see my face? Please let me know. Okay, very good. So most Narcan units, at least the ones that we have at the Recovery Community Center, the ones that EMS might provide to people if they stop stop to assist with an overdose. They might leave behind some naloxone, and they come in little bags. They might be black or they might be red. And if you get your Narcan that way, you will have one of these in the bag. There is a bunch of literature on additional harm reduction tips, on treatment options, other recovery options, and additional resources. Also in the kit, if you get one, there'll be a tiny little plastic package, okay, with a blue thing in it. It's tiny. However, when you open it up, what we have is a face shield that is a one-way breather. So if you see on this side, this valve that is poking out is what you would put into the mouth of the individual who is having the overdose. This side has a flat valve. It's a one-way valve. You breathe into that valve. The plastic covers the rest of the face, and your breath will go into the individual, but the individual's breath or other exhalations will not move into your mouth, okay? So in the world of COVID, this it serves kind of like a mask does. So there's no guarantee. I don't want to say that this will be 100% effective at stopping any potential spread, but it will serve as a mask and a barrier for you to get the breaths while not inhaling whatever might be coming out of the individual. So after you've given those first two rescue breaths, you open up your package. Mine happens to be open. And there are 2 units. And they come in little packages, have a foil back, easy to peel. And inside is the Narcan, or the naloxone. There is naloxone in this little nasal spray. And it's very, very easy. You don't need to push the plunger to prime it or anything. Please don't do that, because then you'll use up all the naloxone. Just take it, and I'm not going to actually put this up my nose, but you put it up the individual's nose, and then after it's in the nose, then you push the plunger and get the naloxone up into the system. Then remember, we want to give one more rescue breath. Put the person in the recovery position on their side with their arm down. Call 911 and ask for EMS. It would be helpful for EMS to know that you suspect an overdose, an opioid overdose. Then return to the individual. Continue to breathe. And if the person hasn't come around, you have your second dose of Narcan. Rip open the package and use it exactly the same way as you did before. It's okay if you use the same nostril, but maybe try the other nostril, either one, just so long as it gets into the person's body. That concludes my presentation. It looks like we have a few minutes to answer questions. So I don't believe I see all of the questions. So perhaps we can have some of the questions pop up on the live stream that I see. Yes, you will get a copy of this PowerPoint, Regina. I sent one. I sent a copy to the Real Voices, Real Choices team, and oh, here we are with the response. So yes, you will get that. Let's see what other questions we might have. I cannot, let's see. How can a person overdose on Tylenol 3? What happens to help? Well, overdose on Tylenol 3 if, for example, they have a really low tolerance. Perhaps they were in treatment, or perhaps they were incarcerated and their tolerance was lowered, but they still have, OUD behaviors. They might consume a large quantity of Tylenol 3, and then that will produce the opioid effect that we discussed earlier. So hopefully that answers your question. Michelle, thank you very much. I appreciate the compliment. Christina Pullman has asked if I have successfully used Narcan before. I personally have not used Narcan to revive a person in overdose, but I know many, many people who have. It is successful. It is successful. I personally have not had to use Narcan on an individual, but I do carry it with me. As a side note, when you carry it, do not leave it in extreme temperatures. Extreme heat or extreme cold will degrade the product. So, but I carry mine with my personal bag. Okay. All right, everyone. Looks like we're coming up at 10:25. Despite our technical glitches at the beginning, it looks like that we managed to make it through, and I really appreciate everyone who is attending, listening, watching live stream, and hopefully that this information you will find useful and practical in your own daily lives.
Well, Sheila, thank you so much for that powerful presentation. I know that is good information for all of us to have in our arsenal. And so just thank you so much for presenting that. We are now going to take a